Pharmacy Pearls, drug therapy that works.
Traveler's diarrhea is the most common travel-related illness, affecting up to 50% of travelers to developing countries. At the same time, there are many things you can do to effectively prevent and treat it. On today's episode of Pharmacy Pearls, I'll be reviewing the management of traveler's diarrhea for people vacationing in developing countries. In most cases, traveler's diarrhea is caused by exposure to bacteria or parasites and is spread through contaminated food or water or by person-to-person contact. Symptoms include nausea, abdominal cramps, and watery diarrhea. Sometimes fever and blood or pus in the stool are present. Fortunately, it's generally mild and self-limited, with most cases resolving on their own after 3 to 4 days. Nonetheless, traveler's diarrhea doesn't have to ruin your vacation. When it comes to prevention, let's begin by reviewing what doesn't work. First, we have the oral cholera vaccine, commercially available as Dukoral. It has been extensively studied, and according to the best available evidence, it does not show a benefit and is not recommended. Second, the use of probiotics has been inconsistent in preventing traveler's diarrhea. As a result, it is not considered the most reliable option. On the bright side, there are several prevention strategies that do work. To begin with, be careful about what you eat and drink. High-risk foods include untreated water and ice, raw vegetables, meat and fish, unpeeled fruit, and food from street vendors. Follow the maxim, boil it, cook it, peel it, or forget it. The safest beverages are carbonated or served hot. Additionally, keep your hands clean by washing them often with soap and water. If soap and water isn't available, use an alcohol-based hand sanitizer. Bismuth subsalicylate, or Pepto-Bismol, which is available without a prescription, can also be used to prevent traveler's diarrhea. It was shown to have a 62 to 65% protection rate in short-term travelers to Mexico. The effective dose is 2 262 mg tablets taken 4 times daily for no longer than 3 weeks. Common side effects include ringing in the ears and blackening of the stool or tongue. It is best to stop it if antibiotics are started, as it may interfere with their absorption. Finally, for those living in the United States, the antibiotic rifaximin can be used. It has a 72% protection rate at a dose of 200 mg twice daily, which is taken while at risk. If you develop traveler's diarrhea, follow these steps to better manage the illness. First of all, it's very important to prevent dehydration. You can rehydrate by drinking Pedialyte, using packaged oral rehydration salts, such as Gastrolite, which can be diluted in water, drinking soups, or you can drink bottled carbonated water or non-caffeinated beverages taken with soda crackers. This should be done for as long as diarrhea continues. You should follow a normal diet as tolerated. Before departing, you can also get an antibiotic from your doctor, which can be started if traveler's diarrhea occurs. There are many options available depending upon your area of travel. As a convenience, ask your doctor for a 1-day course, which is in general as effective as a 3-day course. Using an antibiotic has been shown to shorten the duration of diarrhea by 1 to 2 days. If you take an antibiotic with you, it's important to only use it if symptoms occur. Finally, in order to control symptoms rapidly, you can take an anti-diarrhea medication called loperamide or Imodium. Take 2 2-mg tablets initially, followed by 1 2-mg tablet after each loose stool. Don't exceed 8 tablets per day and for no more than 2 days total. Keep in mind that loperamide should be avoided if fever or blood in the stool is present. Possible side effects include drowsiness, dizziness, or dry mouth. It can be used alone if only mild symptoms are present. That covers the management of traveler's diarrhea for those vacationing in developing countries. Thank you for listening. For more Pharmacy Pearls, please subscribe to my YouTube channel.